All right. Awesome. It looks like we're live. Okay. So, hello and welcome to our talk on mental health. This has been sponsored by Children in Need as part of the Trust's Building Brighter Futures work, which you can see more in the link down in the description. Tonight, we're really lucky to be joined by Chloe. She's going to be talking about her own personal experiences with mental health and how that intersects with her CF. So Chloe's 23 years old, she lives in London and is currently working part-time as a personal assistant, and she's also studying environmental studies at the Open University. She's just joined our youth advisory group and is also part of the NHS Youth Forum. And yeah, I guess we'll just get started. Hi, Chloe.
Hi.
How are you tonight?
Yeah, I'm good, thank you.
All right, fantastic. So first question we wanted to ask you is what brought you to the mental health chat? Why is this something that you want to talk to us about?
So I was asked, like, on Twitter, and I follow the CF youth group on Twitter, and I'm as part of the CF youth advisory group, is wanted to get more involved and talk about mental health, and it's something quite close to my heart as I've struggled over the years with mental health, and yeah.
Awesome. Thank you very much for your time. It's really lovely to talk to you. So first question, do you have any coping strategies for juggling your self-care with your mental health alongside your physical care for your CF?
So one of the main things is actually putting my health first. So actually, like, if I've got studying to do, kind of stopping at a certain point and saying, right, no more studying, I'm going to do my physio now, and being really strict on that, because I think the rest of your life can get in the way. Obviously, there'll be reasons if you want to go out and stuff. I won't do physio at 6. But yeah, being really, like, having a really, like, making it really important to look after myself, and things like exercise and, yes, get scheduling and fundings to do.
Excellent. And so how does that work as well with your, because obviously working part-time, studying part-time, it's a lot to juggle.
Yeah. Relying on the calendar on my phone is like putting everything into that. Yeah.
Yes. Where would we be without calendars on our phones? Fantastic. And then so what effect do you think your CF has on your mental health and vice versa?
So I mean, like, I've always wanted it. I didn't want CF to get in the way of my life, and I've not wanted to be treated any differently. But I found, especially when I went to university, that it was suddenly like a lot to, like, I realized just how independent I had to be and how much extra I have to do compared to other people. And like, student life can be quite hard anyway, let alone with all the physio treatments you have to do. And as soon as, like, the hospital admissions can take a big impact on your mental health, and not being able to speak to anyone with CF due to cross infection, that could be quite isolating as well. So there's loads of things, really.
Did you talk much to your housemates and stuff at university about it, or not really?
I mean, they were aware of it, but in my first year, no, like, I didn't tell anyone. Yeah, that was just something that was still quite personal to me, and I've struggled to talk about. But they were very understanding as soon, like, when I told them, and moved out of halls, because in halls, in your own room, and I could pretty much keep it hidden. But yeah, no.
Fantastic. And then also there's been this huge kind of boom in awareness around mental health. How do you think kind of awareness has changed sort of in your experience of it?
Well, I mean, when I was, say, people watching, and is it 11-year-olds 11 to 25, but certainly when I was 11, there was nothing like this. And I would have loved something where you could just hear from other people with CF and hear like their experience and knowing that you're not alone. And there's so much more that the CF Trust are doing, will be doing. There's peer support and like possible mentoring projects that we might be doing. And I think we're coming a long way, and just definitely in the wider kind of world in general, there's a lot more talking about mental health and self-care. Yeah, no, so I think there's certainly a lot more conversations to be had.
Absolutely. And that kind of cross-infection and being able to kind of through the youth advisory group being able to talk to other young people with CF, has that made a difference for you?
So being on the CF Youth Advisory Group where we're all talking to each other, it does really help, and it's, yeah, I guess refreshing to talk to people with similar experiences. Yeah, but then the difficulty is like if you don't have things like that, groups like that, you don't talk to anyone at all. So for a lot of people, yeah.
Absolutely. I think it's from what I've heard, it's a very isolating experience for a lot of people, especially with the kind of stigma of mental illness kind of tagged onto it.
Yeah,
it's tricky. So final question from me. What have your experiences been in accessing mental health support?
So through my hospital, there's psychology support. I mean, when I was in children's, like I only really saw them when I was admitted as an inpatient. And that one, I suppose I didn't really see the full benefits of it because I was just given a questionnaire and filled it in and didn't really know what to talk about. And it's something that, yeah, over the years I used to really struggle opening up, and it can be quite difficult. But yeah, as well as I think if you don't know where you could go to speak to people, like speaking to family has helped me as well.
I think there's a little bit more on that later. I think we've got some questions that have come through from social media, which I'd like to ask you, if that's okay.
Sure, I'll do my best to answer.
So I suppose that I'll go on to this one first because it kind of jumps on from the last question, which is, do you believe mental health is often neglected by doctors, the NHS and the public?
Yeah, I think so. And that was one of the main things that I wanted to be on here for, because there's not really opportunities to speak about mental health. I mean, when you go to your appointments, it's often talking about your physical symptoms and, I don't know, chest infections, lung function results, and there's very little kind of emphasis on mental health in clinic. I think one of the things I thought that it should be just as important as seeing a dietitian and seeing the physios, that you could see a psychologist, because if you struggle to kind of talk about it, actually having someone there, and if you didn't want to, you could just say, no, thank you, I don't have anything to talk about.
I suppose it's nice to be told where you can find help if you need it.
Yeah.
And I should say that if anyone is watching this and they would like to talk to anyone, you can, of course, go to your CF team. But we've also put some links in the description bar and also on Twitter of kind of talking chat lines where you can find help around mental health. And we're going to be talking a lot more on Twitter about this as well. I believe there's a hashtag as well if you want to be super trendy, which is hashtag CF mental health. And I've just called hashtags trendy, which makes me definitely not trendy. I'm so sorry, Chloe. Anyway, but yeah, if you've got any other questions that have come up from this talk, please just send them over to us on the CF Trust Youth Twitter account, or using that hashtag. So second question from our anonymous survey monkey. For CF patients, when you have to deal with mental health problems because of the stresses of the illness, can mental health affect adherence of treatments and physiotherapy? And would there be a way to increase adherence in those whose mental health has been affected by CF life stresses?
Right, so by adherence, that's if you're taking medications.
Exactly, yeah.
Yeah, I mean, when I was younger, I did find I found it very difficult taking my tablets in public and taking my insulin in public. And I think just being afraid in general that you're different and that there could be something wrong with being different. And as I've gotten older, I realise that it's not, but there's very much an issue that we should be encouraging people to be open and be okay about it. And that's very much it does have an impact on you if you're feeling isolated and different. And I don't know if that answers the question actually, but
I think it does. I think there are so many different things, especially on kind of young children and teenagers. There are so many different pressures that I imagine it can be quite difficult to kind of keep on top of your treatments and on top of everything else. And like you say, if something like, feeling embarrassed in public about taking your pills, something which I think, some people may dismiss as being like, oh, well, just get over it. Actually, it's a huge thing, So I think it's looking at it as a whole as opposed to just kind of just thinking about adherence or just thinking about treatments. You've got to look at the whole thing, the mental health and what the individual's going through as well. So I think you're totally right. I mean, when you were younger, did you have any kind of sort of, now you use your calendar on your phone, but when you were younger, did you have any top hacks for getting all of your treatments done, like when you were at school and stuff?
My parents nagging me, I suppose. And even just having my nebulizers by the computer, so I could be on Facebook, if I had homework, I could read the textbook and things. So just sort of meshing them all together as much as possible, so you're not missing out.
Becoming an expert multitasker.
Me.
Yeah.
Yeah. And pill cases, just having them by your bed, and as soon as you get up, have your glass of water, have your pills, and then it's done. I'd recommend that as well.
Awesome. And then the final question that we had from social media is, I'm 16 and I've been recently diagnosed with CF. I'm still getting my head around it all. I've been admitted for IVs and was discharged a week ago today. I had lots of wobbles when I was in the hospital. I think they could be panic attacks. I think they were because I was scared of having long lines and cannulas, and I hated being stuck in the hospital. I haven't really been sad or angry about being diagnosed, but I haven't felt normal. I don't know how to feel. Is this normal? What should I do?
Gosh, I just can't imagine what it would be like diagnosed at 16. It's such a big change, really. I mean, I've had my whole life to kind of process it, and even living my whole life with it, it's still ups and downs where it's like, oh, I hate CF, I wish I didn't have it, or it'd be so much easier if I didn't have to do physio, this and that. And yeah, hospital admissions are hard any age, so I would say it's completely normal. I mean, one thing that might help with panic attacks is mindfulness, kind of breathing exercises. And actually, when the psychologist visited me in the room, and she went through some of that with me, and that kind of thing is a nice bit of distraction from being in hospital, I guess, going through them all. Yeah.
Fantastic. Yeah, I mean, it's a really big change, and I imagine it must have been a really big shock for them.
Yeah.
But also, just to reiterate that you can talk to your CF team about it.
Yeah.
There are psychologists to talk to and to support you through that. Yeah, and also, as you said earlier, just to talk to your family and your friends if you can. Even if they won't understand it, they will want to listen to you and to support you through it.
Yeah, yeah.
Okay. So we've done a whistle-stop tour through our topics.
Yeah.
Have you got anything that you would like to add, or kind of any last words of wisdom to impart onto YouTube?
Gosh, big responsibility here. I think just knowing that you're not alone, and that there are lots of kind of people also kind of struggling with this, and my involvement with CF YAG, and you realize that like things that you're struggling with, there are other people there struggling with it too. And while it is really isolating having it, I mean, it's I kind of lost my train of thought there. But yeah, no, speaking to people and like taking mental health like days and looking after yourself, like any like access to mental health, whether or not it's to do with your CF or not. I mean, there's lots of information out there.
Mm-hmm.
And yeah, you're not alone.
Absolutely. Absolutely. And if you are 11 to 25 and would like to come and talk to our youth advisory group, which is we meet once a month, and we've just got a group of lovely young people who chat about their experiences, and they also steer the group, the work that we do at the Trust for young people. So kind of think of new projects and that sort of stuff, look at the other things that we're doing and kind of give advice. So if you'd like to get involved in that, again, the link will be down in the description box, and you can find the youth advisory group through that. Send us an email and get involved, because we'd love to hear from you. Yeah, and thank you so much, Chloe. That was really great, and I'm just really glad to have had you here to have a chat about it.
Thank you for having me.
You're very welcome. And I hope that going forward, this will kind of open up more conversations about mental health. All right. And on that, I think we'll say good night. All right. See you soon. Bye-bye.